that will drive digitalization in any country. You must have unique identity, and this is why we come across. The third pillar that we put inclusion, access to financial inclusion, and that is because of our mobile money interoperability. Because today we can only renew our NHIS cards if we can pay. You use the mobile money to pay, or your bank account to pay. You can only buy the electricity units from home if you can pay. So mobile money interoperability is a key figure, and today virtually everybody has a mobile money account, which means it can act like a bank account. So we put those three pillars in place to drive the digitalization agenda. And when we come into the healthcare space, we are very, very keen on making sure we can improve access and make sure that quality health and so on can be delivered. And digitalization has been very key in the healthcare space. One of the key areas that we are embarked on is the digitalization of our hospitals as well as our medical records. Before the government commenced its systematic digitalization of medical records at the public health facilities, all records and documents were paper-based. The process of locating patients' files was cumbersome, and documents sometimes were misplaced or misfiled. You could go to the hospital and they will tell you they can't find your file. All your medical history is missing. This caused delays and inefficiencies in the delivery of health services and reluctance of some sick people to even visit the health facilities. This effort has increased efficiency, effectiveness, and productivity in service delivery in our health facilities. The process of digitalization, eliminating the need for queues and delays, and also increasing access to healthcare by those who need the services. So what we are pursuing now going forward is that medical records and the history of patients will be gathered under a single database which can be accessed by any networked hospital when the patient visits. So we've embarked on the connection of health facilities under the Ghana Health Services on one digital platform. So for all the teaching hospitals and all the regional hospitals, we've connected them and they can talk to each other. In fact, this is taking place under the Lightwave project. And so far, the idea is to network all hospitals in Ghana. So far, we have completed 147 hospitals under the Lightwave project. All teaching hospitals have been networked, all regional hospitals have been networked, and we are proceeding with other hospitals. Since we are in the north, I will tell you what has happened in the north under the Lightwave project. Of the 147 hospitals, in Tamale Teaching Hospital in the northern region, it is part of it. It means that if you go from any of these network hospitals, from Tamale to Kumasi, Komfo-Anokye, or to Kolebu, you don't need to carry your file again to Kolebu or Komfo-Anokye. You just arrive and give them your number. They'll get all your data in the hospital for you, and they will tell you, you took this medicine, this is the history. In Tamale, in Northern Region, we have Tamale Teaching Hospital, the Northern Regional Hospital, the SDA Hospital, in Tamale, Tamale West Hospital. They are networked so far. In Northeast, you have Bunkurugu Health Center, Bindi, Cheriponi Government Hospital, Walewale Hospital, Gambaga Hospital. Janga Hospital. We are going to network everyone. In Upper East, Zebila, Bongo, Sandima, War Memorial, Paga, Talensi, Upper East Regional Hospital. We also have networked the Upper West Regional Hospital. And the goal for us is that by next year we would reach 80% of all hospitals, and by 2024, 100% of all hospitals in Ghana will be networked. This is very, very major. What Ghana is doing is frankly we'll be the first country in Africa to do it when we complete. And then in the world, there are only 3 countries that have done this networking: Germany, India, and China. And if by the grace of God we finish this, we will be number 4 in the world. And that is very, very major. And that is something we should really be proud, that we are able to get this thing. I mean, my friends in England, for example, when they've seen what we are doing, they say, well, in England, if you go to a hospital and you are from another hospital, they'll have to write to the other hospital to send your details, because we are coming late, so we are able to leapfrog. Dr. Bernard Okoboy, my good friend and brother, shared with me his recent experience at the Kolebu Teaching Hospital when he visited patients at the orthopedic ward and chanced upon an NHIS driver who was on admission. The medical team were holding tablets to update his medical records without use of any folder, and this is the power of technology. Distinguished ladies and gentlemen, in addition, the National Health Insurance Authority is digitizing the operations of the NHIS to reduce fraudulent claims. The renewal of all NHIS registrations used to take place at the various district offices. You all remember when people used to come and queue or even sleep overnight for days to renew. And this led to backlogs and long queues. In some instances, as I said, people slept for days, and these delays hampered the operations and limited the revenue streams of the NHIS. Following the digitization, renewal of NHIS registration via the mobile phone through *929# has eliminated these bottlenecks and also increased access to healthcare by those who need it most. Another area where we have used digital technology to advance access to healthcare is through medical drones. The hospitals and clinics in remote and largely rural settings have a difficult time getting medical supplies, especially in times of emergencies involving, for example, snake bites, childbirth, blood supplies needed, floods, and so on. Communities can be cut off, and patients who need of urgent medical care may be too far away to get that care. And many lives are needlessly lost because of hospitals that are unable to access critically needed supplies on time. So to address this problem, Ghana opted to partner Zipline, the world's largest automated on-demand delivery service for medical supplies. I had taken a team from Ghana, from the IT team, to Silicon Valley in San Francisco to see what was at the forefront, and we met Zipline and we convinced them to come to Ghana to set up in Ghana, and we have done so. And Ghana is the second country in Africa after Rwanda to implement the delivery of medical supplies to remote areas through drones. Today, Ghana has 6 medical distribution centers for drones. 6. Omenako, Mpanya, Vopsi, Sefriwoso, Enum, and which is in the eastern region, and Ketikrachi. And these 6 centers are delivering massive services and saving lives every day across the country. It is important to note that currently our dear country Ghana is the world's largest medical drone delivery service. The whole world, Ghana is leading. And what is even more impressive is that all the drone centers are 100% manned by Ghanaians. We are manning all the drone centers, the flight operators, everything, 100% manned by Ghanaians. So far, the drones have done 278,936 flights. 278,936 flights. When a drone is flying, it is taking urgently needed medicine, blood, anti-snake vaccines, all of those things are being taken. So they've done 278,936 flights, and they've delivered over 12 million deliveries, including 8.6 million medical products, 1.9 million child immunization vaccines, and 1.9 million COVID vaccines. And so you can see that the drones are saving lives. They weren't here to take pictures of people in their bathrooms. They were here to deliver medicines and save lives. So many lives have been saved as a result of the medical drones, and in addition, the Ghana Health Service has made significant savings as a result of Zipline drone delivery program, which has reduced theft in the medical stores. What is interesting is that recently the US government has contacted this company, Zipline, to also come and start drone deliveries in the United States. So it is what I'm saying, that we can lead the way with technology. A third area that we have really focused on, I've spoken about networking of our hospitals, drone deliveries. The third area is the e-pharmacy. The e-pharmacy is very, very important. Patients or people generally face difficulties when they are trying to find medicines in pharmacies. They have no way of knowing which pharmacies have the medicines. You know, when they prescribe medicine to you, you don't know which pharmacy has the medicine. They could go to 4, 5, 6 pharmacies before getting lucky. Sometimes patients are directed to go to specific pharmacies to buy the drug, denying them any advantage where there might be of choosing from lower price shops. People also don't know what the prices of the drugs are at the different pharmacies, and tend in their time of vulnerability to just buy at the prices offered when they find the drug. It is also difficult to tell whether the drugs are genuine or fake. There is also the problem of drug abuse with prescription drugs like tramadol. To address these problems, in 2019, I challenged the Pharmaceutical Society of Ghana to digitize the operations of pharmacies in Ghana. Following this, and working with my office and the Ghana Health Service and the Pharmacy Council and the NHIS, the Pharmacy Council, in collaboration with the private sector, has completed the work on a digital platform for all pharmacies in Ghana and has done the pilot. So basically, the digital e-pharmacy platform will offer the opportunity to everyone through a mobile phone to upload your prescriptions and find out which pharmacies near you have the drugs. Secondly, you can compare the prices for the same drug offered by different pharmacies, and you can buy from the lowest price pharmacies. You will be also able to pay with your mobile money or your scan and pay, and then you can have the medicines delivered to you at home because they know your digital address. They will bring the medicine to you at home. So, ladies and gentlemen, so far with the e-pharmacy, all private health insurance companies, the mobile apps are being integrated into the e-pharmacy. The top 100 private hospitals and clinics are also being integrated to offer the e-pharmacy, and the NHIS integration with the e-pharmacy platform is also going on. And we are expecting that next month, with all this integration, we will next month, that is January 2023, we will go live with a full rollout of the e-pharmacy platform in Ghana. What is so interesting, because this is major, this is very major. This will make Ghana the first country in sub-Saharan Africa to have a national scale e-pharmacy, and one of the only few countries in the world to have it. And I'd like to thank everyone, all the stakeholders involved, for making sure we have been able to achieve this particular feat. Mr. Chairman, distinguished ladies and gentlemen, in recounting Ghana's healthcare delivery through the technological platform, the Ministry of Health and its allied agencies are seriously brainstorming on telemedicine to make healthcare accessible. And in fact, once we network all the hospitals and we have all this data, the platform for telemedicine would have been set. And so people from even the United States or Germany or Japan can access the data and help with diagnosis and prescription. So we are really building a platform for telemedicine practice at the primary health care in our quest to achieve universal health coverage by 2030. The NHIS, since its introduction, has no doubt contributed to increased utilization of healthcare services, leading to improved health outcomes of the population. There have been significant reductions in maternal and child mortalities over the last 2 years. Persons who formerly could not access health care due to financial constraints are now able to do so without providing the point of service use. Besides, the NHIS has contributed to financial resources of healthcare providers, resulting in expansion of healthcare facilities, especially of the private sector. You heard Dr. Okuboy saying about 100 million Ghana cedis a month is being paid to healthcare providers. Distinguished ladies and gentlemen, let me narrow on the digitization of the agenda of the NHIS and recount but just a few. The NHIS has gone through several reforms over the years to improve its services to members. On the 9th of November 2019, I launched the NHIS Ghana card linkage at the Accra International Conference Center. And today, over 5 million members of the NHIS have been linked to their Ghana cards to enable them use the Ghana card to access healthcare. And this has been going on since 1st May 2020. Hopefully, when all members of the scheme are linked to their Ghana cards, the NHIS card will be phased out and the Ghana card will be the sole card for accessing healthcare services in the credentialed health institutions. Aside this, we've also embarked, the NHIS has also embarked on a project to, together with the National Identification Authority and the NHIA, the Ghana Health Service, and the Births and Deaths Registry to link the births and deaths data to the NIA database and give unique identification numbers to all newborn babies starting in the first quarter of next year. So we have been putting together and I have been sort of leading the coordination of the Ghana Health Service, the NHIA, the NIA, and the Births and Deaths Registry, because we want to make sure that when a child is born in Ghana, they get their national ID number at birth. And so, by the grace of Allah, this is going to start in the first quarter of next year, and all our children will get their NHIA numbers and will then be able to track everybody from birth through school and beyond. Mr. Chairman, the NHIA has also implemented the National Electronic Medical Claims to reduce the turnaround time for claims, preparation and submission, and reduce spurious claims and costs to the scheme for increased sustainability. Currently, close to 3,000 healthcare providers representing 70% are submitting medical claims electronically. The scale-up of this digital innovation is ongoing. All providers submitting manual claims have been trained, and hopefully over 5,000 credentialed healthcare providers of the scheme will start submitting electronic claims by the second quarter of 2023. Mr. Chairman, the NHIA has also made it possible for healthcare providers that wish to join the scheme to provide services to the members to apply using online application systems. Healthcare providers only send an email to the address and they are there easily brought online. This has not only reduced the turnaround time for processing the applications, but also has saved cost of paper applications with copies of the accompanying documents such as certificates and all of that, including traveling costs. In 2018, ladies and gentlemen, we launched the NHIA electronic receipting platform to enhance social auditing and accountability of revenue collection at NHIA district offices across the country. And I am reliably informed that the e-receipting platform has helped to establish daily premium collection and improve accountability and transparency in revenue mobilization. It has also substantially promoted electronic reconciliation of financial accounts and promoted transparency and efficiency in the financial operations of the scheme. On December 19th, 2018, the government supported management of the NHIS to launch a mobile renewal system to enable members whose cards have expired to conveniently renew their cards. And this has been very, very important. At present, over 16 million people are active members of the scheme, representing 54% of the population, an increase from 40% in 2019. Out of this number, over 80% are old members who use the mobile application to renew their membership. And this has reduced the queues as well as the crowding at the offices of the NHIS. Digitalization has made it possible by just dialing *929# and follow through the process to instantly renew your card without traveling to the office to queue. Now, Chairman, however, we still have a lot of people who are not yet registered on the NHIS. And so the question has been to the NHIA, how can we make it easy for people to enroll onto the NHIS? Especially a lot of the middle class in our country. They find it very cumbersome to go to NHIA offices to queue to register for national health insurance. And so a lot of the middle class, I can say, don't have national health insurance. That is the reality. But if we make it easier for people, whether it's lower, middle, or upper, wherever class you are, because make it easy for people to register, then you will get the registration taking place. And this is why today's event is so important. Mr. Chairman, distinguished ladies and gentlemen, the good news is that the board and the management of the NHIA scheme has gone one step further to make it possible for people to use the mobile application to register as new members using your Ghana card. This is just fantastic. Today, this mobile application, which is called My NHIS app, My NHIS app. Today, this mobile application will be launched to enable people to sit in the comfort of their home, or even when they are in a car, not driving of course, to sit in the comfort of their homes, wherever, or offices, and register to join the NHIS. It will also enable members of the scheme to renew their membership and that of third parties and access the frequently asked questions. Dr. Okoboy whispered to me that under this scheme, third parties can register. You don't have to be the one registering. Your uncle can register for you. And if you are a politician, you can register your constituents, right? So the people of Lejokuku will see a lot of registration very soon and all of that. But the serious point is that third parties can enroll others onto the scheme using this particular app. The My NHIS app, therefore, serves as an NHIS office in your homes or in your pockets. The new NHIS mobile app will operate both on Android and iOS smartphones and will allow NHIS members to securely pay registration and membership renewal fees from their mobile money wallets, bank accounts, and Visa cards. The formal sector workers and businessmen and women, per your busy schedule, do not need to go to the NHIS district offices anymore. We believe that this milestone will accelerate progress towards our quest to achieve universal health coverage by 2030. Ladies and gentlemen, embedded in the My NHIS app is a member authentication feature to enable healthcare providers validate the membership status of members of the scheme before providing healthcare to them. This feature of the application will also help to reduce spurious claims ranging from impersonation and claims manufacturing resulting from collusion between NHIS clients and healthcare providers. So with this one, the kululu is over. Mr. Chairman, as I conclude, let me use this opportunity to urge the NHIA to continue to introduce digital innovations in other operational areas of the scheme to improve services for the members. It is my hope that this year's celebration will be used to reflect the success and challenges of the scheme and fashion out sustainable solutions. I thank you all for your attention, and therefore I want to say, when you think about it, Ghana is using digitalization to help our people. We are networking all our hospitals. We've launched the National Electronic Pharmacy platform. We are delivering medicines through drones. We are linking the NHIS with the Ghana card. We have electronic medical claims. We have NHIA electronic receipting platform, electronic membership renewal. And by the grace of God, I would like to declare the 2002 NHIS Active Month officially launched. And say that we are launching the My NHIS application officially. Thank you for your attention. God bless you and God bless our homeland Ghana.
Can we give the Vice President of the Republic a better round of applause? Thank you very much, His Excellency. At this point, the My NHIS app is duly launched. We will show you a very short demonstration of how it works. But before we do so, we will show you a quick animation. So for those of you here, you have the opportunity to see how it works. Let me also state that currently we are live on the Google or Android Play Store. iOS will come on stream in a few days to about a week. But for now, for those of you who are on Android, please feel free. You can go onto your Android or Google Play Store and download My NHIS. My NHIS, and you will be able to, one, get onto the scheme as a new member. Secondly, you'll be able to renew. And thirdly, you'll be able to link your Ghana card to your NHIS card. And fourth, you'll be able to do all of this for other persons. At this point, can we see an animation, please, of the application?
Hello and welcome to my NHIS mobile application demonstration. Hope you enjoy this tutorial. Let's begin. How to download and install my NHIS app on your smartphone. To download and install my NHIS app on your smartphone. 1. Go to Apple App Store or Google Play Store on your smartphone. 2. Search for my NHIS app on the app stores. 3. Download and install the My NHIS app on your phone. 4. Look for my NHIS app logo on your smartphone screen. How to sign up and create an account on the My NHIS app. Tap on the My NHIS app logo to open the app. Welcome to the NHIS app. Log in if you already have an account on the app. Click Don't have an account. Sign up if you don't have an account on the app. Enter your details to sign up. Accept the NHIS privacy policy and terms of usage and click on Continue. Enter the OTP received as SMS on the phone number used for the sign up. Wait for the OTP to be verified. Welcome to the home screen of My NHIS app. The My NHIS app displays the home screen of the app. At this moment, some of the services icons have been deactivated on the app screen. You can only access the services which have been activated. How to access NHIS information on My NHIS. Tap on Info on the home screen. You have access to the info page at this point, which allows you to view the membership handbook benefit package, medicine list, office locations, FAQs about NHIA, and the social media handles of the NHIA. You can download the membership handbook and share or save on your phone. You can download the medicine list and share or save or search for the medication on your phone. Creating a Ghana card profile on the My NHIS app. Before you can use the services on the My NHIS app, you're required to create a profile with your Ghana card details. Create a profile using Ghana card. Tap on Create Profile. The next screen shows the information required on your Ghana card to create a profile. An example screen shows you how to enter the information required on your Ghana card to create your profile. Enter the details as shown on your Ghana card to create your profile. Select the nearest NHIS district office in the area in which you reside. Confirm your district or change your selected district. Wait for the app to verify the Ghana card details. In case of failure, an error message will display, prompting you to correct the required field. When verified, a successful message will display. Tap on Done. Once your profile has been created successfully, all the services will be activated on the app screen for you. You can now register, renew, and link cards for yourself or others who have Ghana cards. A blank digital NHIS card displayed means you are either not registered as an NHIS member or you have not linked your Ghana card in NHIS card. If not registered as an NHIS member, click New to register. If registered as an NHIS member, click Link Cards to link your NHIS and Ghana cards. How to link your NHIS and Ghana card on My NHIS app. Link your NHIS to your Ghana card profile. Tap on Link Cards. A screen displays the field required on your NHIS card to link our Ghana card profile. Tap on Next. Enter the NHIS 8-digit number on your NHIS card. Tap on Next. Wait whilst the app verifies and links the cards. On success, your NHIS digital card would be displayed. Tap on Done. Your current NHIS membership status is displayed as expired, active, or 1 month waiting period. How to renew for self and third party on My NHIS app. Tap on Renew. Tap on Next. Select Renew for myself if doing a self-renewal, or Renew for another person if doing renewal for another person. Turn on Yes button and enter your SNIT number if you're renewing as a SNIT member. Else, tap on Next. The next screen displays the amount you are required to pay. Tap on Pay Now. The app redirects you to the payment platform. Tap on your preferred mode of payment. In case of mobile payment, enter the mobile number and tap on Continue. SMS OTP will be sent to the mobile number provided. Enter the OTP and tap on Verify. Please wait while the payment is being processed. The mobile number provided will receive authorized payment confirmation. Enter your mobile PIN to confirm payment. On success, a message will pop up. Tap on Done. Your status will display Active. New NHIS registration for self and third party on My NHIS app. New registration for self and third party. Tap on New. Tap on Next. If you are not an NHIS member, the Register Myself icon will be enabled for self-registration. Select Register for another person and tap on Next. Enter the Ghana card number and phone number of the member. Enable the SNIT button if member is a SNIT contributor. Tap on Next to continue. The next screen displays the amount required to pay. The app redirects you to the payment platform. Tap on Preferred Mode of Payment. In the case of mobile payment, enter the mobile money number and tap on Continue. An SMS OTP will be sent to the mobile number provided. Enter the OTP and tap on Verify. Please wait while the payment is being processed. The mobile number provided will receive authorized payment confirmation. Enter your mobile PIN to confirm payment. Please wait while system generates the digital card. On success, a temporal digital card will be displayed. Tap on Done.
Thank you very much for that animation. We want to take it even a step further and have a 2-minute demonstration live up on stage. And to do that, we want to call on our project manager in the person of Mr. Joe Anodankwa. If you're here, please come up. We'll have a quick live demonstration so that you may understand this better and follow through. Please give him a round of applause. He's the project manager for this committee.
Good afternoon, Mr. Vice President, His Excellency, Chief Executive, Board Chairman, all the paramount chiefs here. It's a privilege to be standing here. We'll, just like you saw on the screen, we just want to do one demonstration, live demonstration, and then that's it. So at this moment, because of the arrangement, they are demonstrating at the top, and then I would just explain a few steps. So, Mr. Operator, kindly display the screen. Okay, so as you can see, Mr. President, Mr. Vice President, you can see on the screen, this is the live home screen of the app. So here, the assumption is that the person is already a member. Once you download the app and you configure yourself, if you are already an NHIS member, it will come and tell you that you are a member and give you all your status. Once you know your status, you have the opportunity to use your phone to register as many people as possible. So that's what we are going to demonstrate. So at this moment, our CEO, who happens to be Lajukuku MP, to come